Hello, welcome to today's webinar, Crafting Systems that Work for Infants and Toddlers and Their Families. This session's about exploring QRIS. I'm Debbie Mathias. I'm with the BUILD Initiative. I'm the director of the QRIS National Learning Network. The agenda for our conversation today is welcome, everyone. We're going to talk a little bit about the principles for the Child Care Development Block Grant and how it relates to infants and toddlers. Then we're going to go through the elements of a QRIS framework and think about how it specifically relates to infants and toddlers. We'll think about standards, financial supports and incentives, engagement and outreach, planning, monitoring, and accountability, and the quality improvement supports. Then we'll wrap up. We want this to be a very interactive session, and so have structured it for conversation in the chat box to occur. Share your ideas and comments in the chat box so we can capture more examples and learn together. Identify the topic you're talking about and then share your thoughts throughout the session, including links to documents or websites or anything that you think would help, and we'll post some of this information up with the webinar after the session. This will help us capture resources and ideas to further expand the discussion in the future. Or if you have a question, put a question mark so that we know, and we can circle back if we have time today or get back to you after the session with an answer. The new Child Care Development Block Grant funding represents an enormous opportunity to improve access and quality of early learning for infants, toddlers, and their families, and the teachers and programs that work with them. With funding from the Pritzker Children's Initiative, a project of J.B. and M.K. Pritzker Family Foundation, the BUILD Initiative is organizing a series of webinars and blogs in partnership with 0 to 3 and the Center for Law and Social Policy. This series is for state policy leaders, decision makers, and advocates. We're grateful for the partnership of the organizations who put this together and appreciate the support of the Pritzker Children's Initiative. This session today touches on many of our principles, such as you all know, infants and toddlers develop rapidly, which impacts what they need from the adults caring for them. We're thinking about building the supply of high-quality care and better meeting the needs of infants and toddlers. We're thinking about a systems approach that includes high-performing services, strong and effective linkages across systems components, infrastructure, and scale. States can advance equitable child care by paying specific attention to disparities in opportunity and outcomes by race, ethnicity, home language, family income, and disability. This is a primary concern as we move through this session today. Quality is really the floor for infant and toddler care, not the ceiling. Child care effectiveness comes from quality. For babies, toddlers, who they are at the start of their life, this access to quality has a lifetime of consequences. We're considering how are we informing improvement? What are our cycles of continuous improvement? How are we documenting progress? Critical to sustaining the work. This requires both community engagement and the collection and sharing of data. QRIS should really be viewed as a continuous improvement effort where we're all still learning and developing as we go forward. It's not a research project or even a program intervention. We know that quality is important to improving healthy child development And we have some ways to assess whether a program is quality or not, and also some good ideas about how to improve quality. The goal of QRIS, however, is to help programs engage in a continuous improvement and development through their association with the process. It's not merely a matter of whether a QRIS does a fully accurate job of measuring quality, but whether the QRIS really pushes programs forward to seek improvement in their quality and move states forward in recognizing and providing support for quality improvement. As you all know, there are many complexities in measuring these types of impacts. States are learning as they go forward and seeking to improve both their QRIS measurements and the way they provide support and encouragement based on their experiences, learning from each other, and from the research. We do know that quality matters, especially for infants and toddlers, and the Program for Infant-Toddler Care lays out the elements that help us hone in on considerations for infants and toddlers as we build the QRIS and as we think about how we're supporting programs. So this is our grounding right here. Many of you have seen this slide before. In general, QRIS standards are, so I'm thinking about designing the QRIS. So this includes these 5 big buckets. But if you look at each of these areas, they can have policy and practices where you can use the lens of high-quality early learning opportunities for infants and toddlers and tailor your work. First, in the standards. I always think about this as a 3-legged stool. The standards for practitioners, such as infant-toddler competencies, what do the staff and caregivers need to know and be able to do? Adequate and appropriate early learning standards, and program standards such as licensing, QRIS, Early Head Start. Accreditations, as included in QRIS, often have specific standards or considerations for infants and toddlers as well. The next bucket is rating and monitoring, taking into account the specific needs of infants and toddlers. A number of states use an observational assessment appropriate for infants and toddlers. We need monitors who are culturally sensitive, speak the language spoken in the program, and understand what developmentally appropriate caregiving for infants and toddlers looks like. Moving to our next bucket of financial incentives, how are incentives and financing to provide high-quality infant and toddler services structured? Understanding and accounting for the differences in cost to provide high-quality infant-toddler services. Thinking about quality improvement supports, such as infant-toddler networks, early childhood mental health efforts, and other initiatives. We'll talk more about this area later, and I'm looking for you to weigh in at that time with what types of supports you're using in your state or initiatives to support high-quality infant-toddler services. We're going to think a little about engagement and outreach. What type of information is available for families of very young children? What are their questions? What are they looking for? Let's dig a little deeper into these components, keeping our eye on how the system can serve infants and toddlers and their families. So starting with standards, where are the babies being cared for in the state, and how can we support these providers to improve? States are strengthening the standards for infants and toddlers in the 3 main areas I mentioned before, with aligned early learning standards, practitioner competencies focused on infant and toddlers, teachers and caregivers, and program standards. Let's start right there with program standards. Typically, the QRIS does not duplicate standards included in licensing. Early Head Start performance standards are often more robust than the standards in licensing and in QRIS, particularly in the areas of families, family engagement, and in the health arena. Improving ratios and group sizes, especially for infants and toddlers, is seen as a key quality improvement strategy, but it's often left to licensing to handle these areas because of the financial aspects of it and the inability of current QRIS financing to make up or finance the difference at higher quality levels. For example, if you wanted to reduce the staff-child ratio by 1, how does the program generate the income that all the other licensed programs in the state are receiving for that child that's removed from the ratio and the quality initiative? This is really why states have left and begun to address the group size and ratios in licensing, even as a mechanism to improve the quality. One challenge states are having is how to represent the needs of infants and toddlers. Should it be done in the accountability metric or in the standards that are being monitored and measured, or by putting forward a best practice or continuous improvement side of the work? Often states meet this challenge by using a valid and reliable observational tool in their standards to get to more of the detail, and they cover the missing elements from licensing and the observational tool in other standards for infants and toddlers. But this notion of what's in the accountability metric and how states are working in the quality improvement and best practice space is becoming a question around financing. And do you want more financing in the metric of meeting a standard or monitoring standards, or in the continuous improvement? It's just a challenge we're seeing states wrestling with. Policies are developed to guide program design and implementation of infant-toddler care in a number of states. More than 10 states require policies to address issues such as day-to-day routines and continuity of care for infants and toddlers. QRIS standards are designed to help promote the unique developmental needs of infants and toddlers and include support specific to their care and learning, including the examples on this slide. States may set standards that define quality in infant-toddler care environments. They might be thinking about curriculum specific to infants and toddlers, developmental screening, family engagement standards that have indicators specific to parents of infants and toddlers, more frequent contact with families, areas like that. The Head Start performance standards and some QRIS standards are designed to help promote these linkages. They might have infant-toddler professional development for caregivers, or be looking in hours of caregiving that are required if the teacher is from an infant-toddler classroom or setting. How are the, I'm seeing a sign that says no audio, but I hope that's not me, how are they related to infants, and how's your professional learning experiences related to infants and toddlers? Okay. They might look specifically at the physical space requirements to promote infant and toddler physical development and provide sensory and learning experiences. assignment of primary caregiving system, as well as policies and procedures that promote continuity of care. Some of the standards may be looking for linkages to the Part C early intervention system. So in the chat box, if you would talk about, does your state have specific standards in the QRIS related to infants and toddlers? And what are you learning as you see those standards implemented in programs? So just take a moment, and if you can think of something specific, this will help your colleagues understand that there's a lot of innovation and strategies being tried in states to push on what are the unique developmental caregiving needs for infants and toddlers. The latest CCDF law, and you'll see some ideas starting to pop up in the chat box for you to look at and see what your colleagues are working on. The latest CCDF law sets aside funds for states to commit to the following types of infant and toddler child care quality initiatives. They include things like comprehensive services to more infants and toddlers from low-income families, technical assistance and consultation, professional development of the infant-toddler workforce, improvements in infant and toddler early care and settings. How are we implementing and how have we developed the Align Early Learning Guidelines for infants and toddlers? How are we enhancing subsidy rates for relationship-based caregiving or in the infant-toddler sector? The CCDBG also allows funds for infant-toddler credentials and infant-toddler specialist networks. Some of the recommendations around practitioners are to support a diverse and culturally competent workforce, to promote competitive compensation and benefits, provide access to training, education, and ongoing supports, establish core competencies specifically related to infants and toddlers, and focus on relationship-based care, which would include a primary caregiver, small groups, continuity of care, individualized care, inclusion of children with disability, and culturally sensitive care. So all these could be written into or looped into standards and or, as I mentioned before, the support side of the work. So how are you working on this in establishing standards, and how are you working on this to provide supports that get to these recommendations? Now to think about standards for practitioners. States are really thinking about, and there's a lot been written and a lot of good resources around infant-toddler credentials, specific professional development for teachers. Compensation and benefits are included as standards for 19 states. But states are also thinking at the context for teaching and caregiving, including paid planning and consultation time for teachers. Washington and Oregon specifically have a standard around and an emphasis on programs supporting diverse families and culturally competent teaching, interaction, and engagements with families. So if you have specific standards around practitioners, please enter those into the chat box and share your ideas with your colleagues. How are they working? What are you learning about how this is playing out with full implementation? The final leg of the stool are around the early learning standards. And I just shared a couple of examples that I pulled off the web for you to see. How are your early learning standards driven through your program standards and your practitioner standards. Because in my mind, these kind of serve as the basis for what do the teachers need to know and be able to do, and caregivers, and what are the standards in the program. So these are the standards around what we're looking for in infants and toddlers, the early learning guidelines. One of my questions in terms of the early learning guidelines is, has your state worked to implement and institute the early learning guidelines for your state across home visiting, early intervention, child care, and early Head Start? And how reflective are your early learning guidelines of the early Head Start guidelines? So just in terms of thinking about, we can grab and share ideas and learn from each other, and there are some national organizations that have put forth guidance, support, and help for us in thinking about this. And states are really, I have to say, doing a terrific job of thinking about how the early learning guidelines serve as a basis for programs implementing strong early childhood programs in this birth to 3 section. And I see someone in the chat box saying, and I was just making this point too, it's important for teachers to see how their early learning guidelines align to the Head Start performance standards or ongoing assessment. It's not just another thing to do. I think that's just such an excellent point. It's really foundational to our work. So that's the bucket around standards. And now we move to financial supports for programs, practitioners, and families. States are trying a number of innovative strategies here to work on supporting infant and toddler program. A number of states have implemented financing that for subsidy requires the children, the high-need children receiving subsidy to be housed in higher quality settings. They're allowing families to make smaller or no copays when selecting higher quality, and there are ongoing financial supports for providers. And here you can see a couple of examples of how states are financing to support infants and toddlers. States are becoming more strategic, thinking about how to increase publicly funded, when they think about how publicly funded pre-K is impacting the birth to 3 market. And they're really seeing that consequence and raising rates for infant toddler care and then tiering those rates for higher quality settings. We've had a number of other sessions in this series that provide additional information about the financing work, such as Seize the Day for Babies, child care assistant opportunities for infants, toddlers, and the providers who love them. And there were 2 sessions on that. And then we have one coming up that's just the beginning, Advocacy to Sustain and Expand Funding for Infants and Toddlers. So what types of state strategies has your state tried to really infuse money into this often the poorest sector of funding, certainly in the child care arena, the one that's the most expensive, the one that some of us might say is the most important for children's future and their dispositions for learning. And so what kind of strategies are you trying for the financing bucket? And refer to the other sessions for really a lot more great detail in how states are tackling this. So in thinking about engagement and outreach, I know that many states are working very diligently on what's their forward-facing mechanism to help families find high-quality early learning settings. How are they expanding access to comprehensive services and screenings. How is the state promoting family engagement? A number of your websites are just really becoming great wealth of information for families to access information about child development and all kinds of topics that parents are concerned with and worried about. I've seen states using a variety of languages and approaches to this work, building off of a website into social media or really easy to access formats. I'm seeing some really, so if you have a great website and you're really proud of it, or a good way that you're providing information to families with very young children and other services, I know that many states are going beyond on their website search functionality, beyond child care, to providing information about early Head Start, home visiting programs, early intervention Part C, and states are really developing the full portfolio of information for families so that they connect with the services that most suit their needs with very young children. So if you have something, I can see in the chat box that someone allowed Early Head Start Child Care Partnership to participate in the tiered subsidy reimbursement. I can see other people talking about incentives for higher quality. A number of states really increase their base rates for subsidized child care in the infant toddler sector. So I know that states are very concerned about this youngest population and how we're working to provide the supports that are needed. And thanks to all of you that are sharing the ideas in the chat box, because they're really enriching what I'm saying. We have one question in the chat box, an interest about what states are doing to incorporate linguistic and cultural needs and differences in their outreach and engagement strategies. One example that I've heard and is seeming to be very effective is it was reaching out and working with community-based organizations that are working with diverse populations and asking them what they know, what they think would work, of course, providing information in multiple languages. But it takes more than providing information on a website. So I am interested in seeing in the chat box if you have other ideas to move into community and get closer to families. The voice of families, how is it reflected in your policies and processes, and how are the programs that you're putting on the ground working for children and families, especially this age group with parents of very young children. Thinking a little bit more about the engagement and outreach, states are taking many different tacks of funding and using initiatives in the state to support families of very young children. And they're selecting these initiatives based on their constellation of providers, what the providers and caregivers are needing to improve their services, and also they hand in glove with that, they have supports that they're offering directly to families. Things like the Help Me Grow initiative, like Strengthening Families, the CEPHL model, initiatives for families like LENA, the FIND Project, VROOM. And these are initiatives that can be very helpful and useful to family providers as well. So states are very strategically looking at what are providers telling us about improving quality, what are the challenges that they're facing, and what array of initiatives is the state putting on the ground to improve family engagement and to support families of very young children. And we're seeing some comments now about Lena and Find and states that are using those models, or installing something like the Cephal pyramid model to help providers. So please, in the chat box, I'm very interested to see what initiatives for caregivers and families of very young children is your state supporting or investigating. Some of these models are more, are promising practices. Some are research-based models. But I just know that states are trying to be very strategic in the array of services and in the array of supports they're providing, in partnership with their health department or family services, child welfare departments. How across the system are the initiatives working? How on the ground and community are they working? And how are you adapting or thinking about the models, and what do the different models and initiatives bring in terms of cultural sensitivity, working with dual language populations, and all types of diverse populations. So I know that states are really considering the strategic use of their funding and which models and which initiatives they're supporting, and how these initiatives are aligned and linked together. In the planning, monitoring, and accountability bucket. Okay, this is another one of the buckets at the beginning. We're switching topics. In talking about this, states are either expanding, many of us are expanding monitoring even into family, friend, and neighbor settings. But how does the expansion of monitoring and technical assistance, it could make an important difference in key elements of quality for infant and toddler care. States can provide training for monitors so that they can identify health and safety issues that are important for the healthy development of infants and toddlers. So I'm thinking about even underneath the QRIS work, how are we supporting our licensing staff to really understand the unique needs of infants and toddlers and provide that baseline support for programs in health and safety. Further, I would say states are considering how they support their infant-toddler coaching cadre and to improve their skills and competence, and what's the ongoing community of practice or developmental scheme that you're using to support that cadre of infant and toddler consultants. And there are a number of terrific papers written about that, and states are really putting a lot of thought and innovation into how are they supporting all of their technical assistants and coaches. States can provide skilled and knowledgeable technical assistance to providers that focuses on promoting health and safety and coordinate this technical assistance with other state initiatives. So when does General Quality Improvement Navigator hear from a program that they need specialized help in their infant-toddler programming, and what type of supports is the state able to offer to really improve that in family child care and in the infant-toddler spaces. Babies and toddlers, as you all know, are vulnerable to illness and injury and need providers and caregivers who are knowledgeable and can accurately and consistently implement health and safety practices to ensure children's well-being. So thinking about what's the array of professional development, available not only as we just spoke about for the monitors and the coaches, but what's available for the programs on the ground. Regular monitoring of child care providers that includes unannounced inspections can increase the likelihood that key health and safety regulations are implemented correctly and consistently. And as a follow-up to provider training can improve routine implementation of these important health and safety measures. I think that part of planning, monitoring, and accountability is not just the monitoring side, the technical assistance side, but how are we using our data related to infants and toddlers? How are we analyzing? Are our infants and toddlers in higher quality settings? Do we have a lot of high quality settings in high need areas or zip codes or neighborhoods? And if we don't, that's a problem of practice and a problem of policy that states are really investigating and digging deeper into. Why isn't this initiative and the way that we've constructed it working for the population that we most want to impact and support? So we see a lot of states looking deeply at their data in terms of infants and toddlers, especially in high-need zip codes and neighborhoods, to see how their programs are working for this very important population. States can make technology improvements and stronger linkages between their licensing, QRIS, and home visiting data systems to better understand how the whole array of the programs that the state is putting on the grounds are working for this very young children and addressing disparities and gaps in the system. One interesting initiative that we've seen states thinking more about, and this could belong more in the financing bucket maybe than here, but in terms of linking proportionality of infant toddler spending to pre-K spending, in this instance, to think about improving quality. I know that many of you are really analyzing your return on investment in the infant and toddler quality set aside for the Child Care Development Block Grant and thinking very deeply about what are the array of supports and are we getting what we need from those supports, and how do we need to re-envision or reinvent them to get to the result that we're looking for in our state for the populations that are the highest priority for us. So this notion of looking at what and how you're financing and thinking about how are you measuring, looking at your data, how are you measuring the success of your investments, and understanding if it's working to improve the setting for very young children and their families. If you have ideas or thoughts about this, please share in the chat box. This is, I think, a challenging area for many of us. How do we measure the success of technical assistance? How do we measure, the impact of the services on infants and toddlers and their families? How do we plan when we're sitting around planning tables? How do we have the diverse cadre of people planning the initiatives? How is family voice represented at our tables? How are families of young children and how are infants and toddlers and their voices heard at our planning, monitoring, and accountability tables? I think that these are very important concepts about getting to family voice and how are we hearing what our families need. I know that I had 3 children, and when I was using early learning settings for them, I was a working mom, and thinking about leaving my infants and toddlers in care, I was very concerned with the quality of the care that they were getting, knowing how important these early years were. and really the providers that could speak to me as a young parent and provide support for me and resources, that was also a key indicator. So thinking about how are all the voices and diverse needs heard at your tables is very important. I'm seeing people using different observational tools in terms of accountability and just to help programs measure progress for themselves. You know, do they understand and know how those tools can help them identify gaps, structure their own improvement strategies? So that's a great idea in terms of measuring progress and being accountable. Now we're thinking about probably, here's one of our favorite topics, or one of mine anyway, is the improvement supports. So this could speak to how are we spending and thinking about the infant toddler quality set aside, how are we supporting our professional development trainers, coaches, and technical assistance providers. In fact, one of our sessions in this series was called Reaching Out, Using Consultants to Support Best Practices in Infant and Toddler Care. And so what strategy is your state, or which of these mechanisms have you implemented in your state? I think this notion of leadership and how are we leading the day-to-day practices in family child care, in infant and toddler rooms, what types of supports and how are we constructing them, and how are they working for providers to move the quality forward. So if you have strategies around consultation, your infant toddler specialist network, or a page on your website that speaks to these different strategies for improving quality and services, throw a link up there, throw an idea up there, and share your ideas about how you're, or the array of quality improvement supports you're conceptualizing for this infant toddler population in different settings, across the settings. I heard that a state is using or focusing one of their home visiting programs on home visiting for family child care providers, helping family providers in the trenches with support, helping them answer questions that are on their mind, and providing resources and technical assistance for them to improve the quality of the services. So we're seeing that one state has a strong network supported by their own reflective practice, community of practice, and that they're thinking about these other strategies as well. So how within a center are we finding that lead teacher, that director that can really help, you know, support and become the expert on the ground in the rooms to support the practices day to day in programs? So yeah, a lot of good chat there about the questions that we're posing here. Thank you very much. So we talked a little bit about quality improvement supports and supporting all providers and families. States are really delving deeper into this as they're analyzing their data and thinking about how are they serving the needs of all their families, children, and providers. And they're trying to think about how do we better support all of the providers, all of the families. So we've seen states, and there's a report we can pull off of the quality compendium related to specific measures related to cultural competence in their QRIS. Many of these shine through in the family engagement category. So how are programs engaging their families? Are they using the home language of the family in written materials and in conferencing and meetings with families? States are developing, of course, training materials and other supports in multiple languages. How are we matching our TA provider to the culture and the language of the facility? States are innovating around diversity categories. Other states are thinking diversity and tending to diverse families needs to be embedded in all of our standards and not a separate category. So we're seeing states take different tacks in how they're addressing this area. We're seeing states think about financial incentives for dual language teachers and supporting teachers with multiple languages or single home languages in terms of scholarships and improvement of their credentials, and just a lot of innovation as states are digging deeper into and with communities about how to support diverse populations. If you have something specific or ideas around this or links or websites that would help us all work on this, there was a great paper I'll post along with this session from the Migration Policy Institute about how QRIS is working in diverse communities that gives us food for thought. So there's a lot of deep work going on here as states look to broaden and to have impact across their states. Some of the challenges that I've identified, and I have an other here for you to join in on, sometimes when we talk about the few and the powerful standards, what are the few that we could monitor and measure that are powerful indicators of the quality of the setting so that we can focus our financing strategically in the quality improvement arena and identify the best practices. So states are really thinking about how to work with this few and powerful. Sometimes few and powerful means less attention to specific populations or diverse populations. So you just need to think through, how does few and powerful play out for infants and toddlers? How does it play out in terms of cultural competence and standards and diversity? So it's just a challenge. It doesn't mean there isn't an answer, but when we reduce the numbers of standards, sometimes the reason standards get multiplied and added to is to work through specific identified populations, such as infants and toddlers. So it's just something to be wary of. You're like condensing and contracting the discussion around which standards are the few that we're going to monitor and measure. And then I think it becomes incumbent upon us, and we're seeing innovation around now how are we articulating the best practices in our state and where we're headed around the standards, and what's the protocol for improvement around the accountability structures, right? I think, as all of you know, workforce sustainability and qualifications and development is a huge challenge that many states are innovating around and really thinking deeply about and finding some supports and ways to address these issues. I see a great challenge presented in the chat box about supporting remote programs and rural programs with real-time training and feedback. So that kind of leads to this notion of technology and how can we use technology and bring providers along in use of technology. I know that it's disheartening to think that you've paid for 3 hours of technical assistance from someone, 2 hours of which is driving their car somewhere, right? Or it could even be more than that. And so, trying to figure out how to use our money wisely, but still have the impact that we're seeking in terms of the quality of the setting and the program. Um, um, yeah, I'm seeing someone say, yes, I tell programs that are remote the importance of bandwidth and connectivity, right? So what are our new ways of working? What are our strategies? What does our learning management system look like? How robust is it? How are we borrowing ideas and strategies from each other? Don't recreate an infant toddler professional development opportunity or support. Let's learn from each other and share resources and ideas. I think that that's our best investment of money, our best and most strategic way to work, and so learning from each other is just key in all of this. I think that people are struggling with financing for quality. And that's the movement from child care as a welfare to work program to understanding that this is our biggest child serving group typically in states, of the under 5 group, and realizing the important impact that what we're doing in this space and the quality of the settings for the children is laying a foundation for not only school readiness but success in school, the ability to be successful in school. So I think that we've come a long way in seeing that the quality of childcare is critical to the success of the future within our states of our workforce. I'm seeing the challenge of facilities as programs work so close to the margin and with the costs that they're incurring. Very few child care programs are setting aside facility development money. So we've seen states take some very unique strategies about facility development, financing at low income, low interest rates, and really trying to tackle this facility and baseline equipment, facility, and setting the stage for the critical, of course, teacher and their skills moving into it, but the facilities and the environment are key as well. I think that we're having a challenge, and we see in the chat box that challenge of how do we include family engagement? How do we measure family engagement? How do we improve family engagement? How do we all understand at all levels of our system building just how critical this family and community aspect of the work is? There are more and more resources being written about QRIS as related to community engagement, and an interesting thing that I've seen is cities and communities taking on this infant toddler challenge at the very local level and seeking additional local funding and support for this important work. So I think that we have something to learn here from communities and families about engagement, right? We have a challenge with the workforce professionalism and stability matched with the compensation, all of it lining up together. Thank you. You've added a lot of great ideas to this list, and I really appreciate it. And maybe I should update this before I put it into the online service with those great ideas. All right. Just in reflection, we're looking back at here are some of the resources that I pulled from for some of the content today. And I'd like you to just take a moment and have you respond in the chat box with any other ideas or thinking about how you're leveraging your systems and QRIS specifically to support the needs of families, very young children, and the providers working with the children and families. Is there anything else that you'd like to add into the chat box in terms of ideas that you've been working with or sharing? I think that someone in the chat box just put this idea of a challenge of the multiple definitions of high quality services. I think that is a challenge, and that's why I've seen a variety of states and some national groups working to really look and understand what are the standards of early Head Start, in licensing, in the QRIS, in accreditation, and crosswalking them all to understand how they relate together and how it informs our quality improvement activities. And really, in the end, how does it inform our professional development systems and our technical assistance? So now this would be true with any age group, but if we're thinking about using an observational assessment, how's the data from that observational assessment being flipped to the PD and TA providers in your states, and in what format, to guide their development of and inform the development of professional development opportunities and technical assistance for programs and caregivers. So, and really thinking about how are we using the data that we have to craft and structure out our systems. And we're seeing that the parent-family community engagement resources are for both child care and Head Start programs. So there is a lot of great information available from early Head Start and from these resources for all settings across the sectors. All right, in terms of wrapping up our series for today, I'd like to remind everybody that we have our final program on Monday, October 22nd, about just the beginning. Now we've thought about and identified innovative strategies and ideas across the sectors that really relate to infants and toddlers. Now, what's the advocacy angle to sustain and expand funding for infants and toddlers? So I'm really looking forward to that session, and I'm sure many of you are as well. I'd like to thank again the series sponsors, the BUILD Initiative, CLASP, and 0 to 3, for all of their thoughtful work. There are blogs on our landing page and a lot of resources attached to this work as we really work to get deeper into thinking about how we're providing systems of care and support for families and babies and toddlers. So if there are any final questions, my reflection is I would just feel it's been an honor to present on this important topic. I remember when I was a child care director in the field, and this was, back in the 80s, and we had been providing programs for preschoolers for a number of years in NAYC accredited settings, and we had parents begin to approach us and say, you've got to start providing care and services for infants and toddlers. I'm having a baby, or just start to think about, families' needs with the pre-3 group. And my first thought was, even though we're an accredited program, we're not good enough yet to provide care for infants and toddlers. And I really think there's merit in that thought, that this is, who is going to love that baby, love that toddler, and support that family as being the child's first teacher. There's a lot of passion and thought here about the importance of this critical age group and how we're conceiving and building early learning opportunities for them. So I'd just like to thank everyone again for all your engagement and ideas in the chat box, and look forward to meeting some of you in person down the road. And thanks to all the familiar friends I also see on the call today, and all the best in your important work thinking about our little ones. Goodbye.